So you can see that the topic, at least once we get onto it, might be a bit of a strange topic, you might think. Hippocrates in the marketplace, the origins of Western medicine and healthcare. Well, the subtitle tells you something. Why are we talking about Hippocrates? Why on earth is somebody who may or may not have even been real so important to you sitting here in 2016? Well, he is, as I hope you'll see, even if he wasn't a real person. His name and his legacy, you might say, is still very relevant today for any of you who choose to go on and do medicine and surgery or whatever it is you want to do in your future careers. Here's my little spiel about why this is a very important topic. I mean, plainly, I'm prejudiced, as it is my particular area. But I do genuinely think this is an interesting topic. Why? Well, if I'd been standing here about 20, 30 years I would have been telling you that as medical science students, you should be knowing about the triumphs of modern medical science. I would be telling you it can't get much better than this. Western medicine has more or less reached its peak, I would have been saying. And we don't really need to know why. We just need to know that, well, we're just all so brilliant that obviously we have the best medical system in the world, and look how many people aren't dying anymore, and look how many people are living, etc., etc. However, you may not be aware, or you may, that round about 1970s, 1980s, there was a bit of, shall we say, a roadblock to that kind of approach. A few unfortunate things started happening. Of course, there was the whole AIDS epidemic, which gave everybody a very big shock because that kind of thing wasn't supposed to happen anymore. Various diseases that we thought had gone into abeyance started coming back again. Various other, if you want to call them diseases, perhaps more health problems of civilization, as we call it, like obesity and things like that, started raising their ugly head. So it appeared that perhaps everything wasn't as wonderful as we thought it was. But I hope to show you that this kind of thinking we're really good and then taking a step back is by no means new. It's happened for the thousands of years that we've known about. And what I also want to try and persuade you is that in 2016, certainly in Western countries, and indeed other countries as well, the medical service is pretty good. But in some respects, other civilizations, other periods, have actually got some approaches better than us. It's not all been a constant progress, as I hope I'll show you. There's some particular topics where, all right, you mightn't want to go back and be a medieval peasant, perhaps, but nevertheless, perhaps you wouldn't be quite so open to some health problems as we are now, unbelievably. So, an antidote to hubris, an antidote to thinking we're absolutely wonderful and we've reached the peak, as it were. And also, perhaps more important, maybe even most important, fostering an understanding of the connection between medicine, healthcare, and society. Medicine and healthcare, scientific medicine, are never seen in a vacuum, ever. They arise in the society that they belong to, and they arise for reasons. As we'll see with numerous cases, it's not just sheer genius that encouraged, for example, bacteriologists in the 19th century to look for microbes. There was a reason for it. And the reason, of course, was the appalling health of people in the cities, for example. So unless you see healthcare in its context, you simply don't understand why people are doing what they're doing. It also accounts for change. Does a particular kind of healthcare not make things better for the society in which it's emerging? And if it doesn't, there'll be a change, which is what we call a paradigm change, and I'll talk about that in a later lecture. Not working anymore, we'll have to think of something different. And we see this in a historical context. You're all sitting there today just thinking our medicine is our medicine, our healthcare is it's perfectly ordinary, it's just what you would expect. Because you don't see it in any kind of strange way, because it's what's happening today. But I can almost guarantee in 30, 40 years' time, people will be looking at 2016 and saying, they did what? And people submitted themselves to what? Oh, uncivilized lot that they were. It happens time and time again. Each generation thinks the one before it really didn't do very well, even though it appears okay at the time. The picture I put up there just very quickly before we move on also, of course, tells you about the movement of history. I don't know if anybody wants to, I know, sorry, it's a bit small. I think it would come out quite so small. Does anybody want to hazard a guess about who these people are and where they are? It's a photograph, obviously. An elderly bloke in the middle here. Students round about. Hint, hint. Any ideas? No? OK, well, let me tell you then. It's Sydney University in the 1890s. It's in front of one of the new buildings, which were very new and snazzy then, possibly the Anderson Stewart building. And that was, I've just forgotten his name for the moment, but that was the professor of medicine at the time. And look, they're all male, except, one female. She was the first woman to actually, and that was in the 1890s, which historically is not that long ago. Before that, a whole lot of you, obviously the female ones, wouldn't have been studying medicine because women certainly just weren't admitted. So there's a change for a start. And that's something we can also look at. Did everybody suddenly realize that women were actually brilliant and could study medicine? No. There were lots of other reasons for it, which we'll look at. OK. So let's just look for a minute at what you might call, this always gets people's attention, funny that, current illness stories. But you think, but it's not an illness story. If you're ill, you're ill. I'm not telling a story. I'm not saying for a minute that what you're suffering from at a particular time is made up. That's not what we mean. What we mean is, however, we tell ourselves a story when we're not well. In fact, of course, what we would be talking about would be perhaps infectious disease, cancer, autoimmune problems, some of the things that we give labels to these days. But basically, we're telling ourselves something. You wake up in the morning, you're just not feeling very well, you've got a bit of a headache, you're a bit achy. You don't think things like, usually anyway, you wouldn't normally think things like, the spirits have attacked me during the night. Well, you might, depending on how you wake up, of course. But it wouldn't be a normal sort of reaction. Normally you would think, a bacteria or a virus, probably. Maybe I'll just see if it'll go away by itself. If I get a bit of a high temperature, maybe I should go off and get an antibiotic. All of that is a story. 200 years ago, nobody would have thought any of that stuff because they didn't know about it. So, to a certain extent, we construct our own stories about medicine. Doesn't make them not true, it just means we put them in a particular way. And we'll see how that works in a minute. But these terms all tell us about perceptions of the body. How does the body work? I'll have an antibiotic. That means we think our body's been invaded by something, bacteria. But you've got to have a conception of that before you're going to think that. Bear that in mind when we look at a lot of these topics. And also, of course, we're going to look at, well, what actions do we take on the basis of what we think is the matter with us? So there's a little clue that we're not going to be saying all these people in the past were just stupid because they didn't know what to do about sickness. They probably had a different worldview from us. And we're going to see in just a minute a particular group who definitely did, because it makes it quite clear. The reason I put the cocaine tooth drops up, apart from always getting people's attention, is that cocaine was actually a perfectly legitimate kind of therapeutic at the end of the 19th century, just when dentistry was starting to become, I was going to say popular, it's never very popular, is it? But when it was becoming useful. And dentists needed some kind of anesthetic, painkiller. Cocaine, unsurprisingly, looked like a very good one. The trouble was, a lot of dentists, and other people as well, became addicted to it. And so it had a little problem. So they had to start looking around, obviously, for other anesthetics. But an advert like this wouldn't have raised any eyebrows in the 19th century, which has to tell us something about different sort of perceptions of things. All right, let's go and see how some of these things actually work in practice, in actual situations. So each week, as I've said, sorry, I was a bit ahead of myself there, each week we'll look at the background to some current beliefs about health, disease, and medicine. I should say that we've only got 11 or 12 weeks or whatever it is. I think it's actually 10 weeks of lectures. So I obviously could have picked lots of different topics. We could have had a lecture series with 10 completely different topics. But I've got to pick and choose somehow or other. So I picked and chose ones that I thought demonstrated the kind of points I'm trying to make here best. Some of them you'll probably find more interesting than others. But overall, I think they give you a reasonable picture of what we're talking about here. We'll be going over about 2,000 years, which is quite a challenge. So sorry if we leap through a bit. But there will be the PowerPoints. This year, we're putting the PowerPoints up on the Moodle before you come, so you can look at them before the lecture if you like. And you can also listen to the audio if you like, if you think it's all gone a bit fast in class and you didn't quite catch what it was about. Okay. So this week, we're going to talk about health and the environment. Obviously, a very, very topical issue these days. There's no way, hardly any way anyway, you can talk about it, about health, without mentioning the environment that you're living in, whether it's the built environment or the natural environment. Some countries, of course, their environment is very, very directly bad for your health. Not clean water, not clean sewage, not particularly good ways of removing sewage. In the West, on the whole, we've got over those problems, but apparently we still have environmental problems. So we're going to look at where this idea came from, and I think you'll see quite a lot of similarities with today, although you'll also see differences, and you might like to think, why similarities, why differences? Okay, so there are connections. This idea of healthy minds in healthy bodies is a very, very ancient one. Something we're very keen on today. You can see the heart symbol there with all the different good kinds of fruit and vegetables that'll give you a healthy heart and healthy bodies. Exercise. Don't just sit around like a couch potato. Get off your bottoms and go and do something energetic. Not new ideas at all. Although we'll see at various times they weren't so popular. But we're going to go back to a time when healthy minds and healthy bodies in the healthy body were very important. We'll see why. Okay. So, a very quick bit about what we call ancient medicine. Ancient medicine's a useful term because it doesn't specify a date. It kind of means really, really back there. A long, long time ago, before there's much in the way of written records, before people were living in towns and cities, when they were certainly living in groups, but not towns and cities. So often this healthcare in this period is referred to as primitive medicine. If you do any readings, you'll see that that's a phrase that comes up. Now, primitive is not meant to be pejorative. In other words, that means kind of an impolite way of talking about it. What it means is first. It's from the Latin. Any of you who know Latin, primus means first. So it just means the first kind of medicine or healthcare. This kind of medicine, and we still see it in some parts of the world, and indeed in some Aboriginal medicine, not that that's my special area, so I'm not really able to talk about it, but obviously it still exists. But it existed everywhere first. This was everybody's first approach to trying to keep a healthy tribe or clan or whoever they were. So what did this natural, supernatural connection involve? Well, it involved social relationships, and actually I should have put up there also relationships with the environment. So social and environmental relationships within groups, tribes, and villages, because initially, of course, you know, most people were individuals just kind of wandering around by themselves. Gradually, they'd get into groups for self-protection. Then they'd become perhaps a tribe. And then gradually, the tribe would settle down somewhere, and it would become a village, and eventually, of course, as we'll see, towns and cities. But in these early days, how did people approach being sick, and how did they try to avoid it? Well, they obviously didn't have antibiotics or much in the way of surgery or anything like that, so what did they do? They had quite a cunning way of looking at this. They'd say to themselves something like, imagine the scenario that I talked about earlier, when you wake up in the morning feeling a bit shivery and headachy. Okay, in this kind of early primitive medicine, they wouldn't think about viruses and bacteria, obviously. They would think something like, oh, plainly the spirits aren't very pleased with me, because I wouldn't be feeling so bad otherwise. This must be perhaps some kind of punishment. I mean, I'm simplifying here, obviously, but something along those lines. And then they would think, here's where the bit about what can you do about it comes in, I must have displeased somebody. Maybe I wasn't very nice to my family. Maybe it was stealing that neighboring tribe's cattle. You can always come up with something, can't you? I mean, if you actually thought that was why you didn't feel well, I'm quite sure all of you and me as well could come up with something. It's like, no, not very different. You're just not feeling very well. Could you have picked up a virus somewhere? Oh, well, that was that person coughing next to you on the bus. Now, you rationalize it, don't you, somehow or other. So that's what they're doing. All right, so what can they do about it? What they can do about it is set the social relationships right, or indeed the environmental relationships. You can return the cattle. Well, I'm not sure how many people actually did that, but still. You can make it up with your family. You can stop doing whatever it is you thought you were doing that was displeasing the gods or the supernatural creatures, whoever you happen to believe in. Now, that might not be our exact attitude to things, but look at it this way. There was something you could do. If we have a virus, for example, if that's what it is, we don't really get anything to do we? You just get to it. You've just got to put up with it, haven't you, until it goes away. A lot of other much more serious things as well. And we don't know why we've got it. Look at the way people who unfortunately have perhaps some kind of cancer, or their relative does, say things like, why me? Why did I get it? Why not somebody else? Why I let it go, you know, that kind of thing. It's awful. But in this kind of primitive medicine, it might not be what we believe in, but it gave people an answer to the question, why? And as we'll see, Western medicine, here's one of the bits where it falls down a bit, we're not good with the answer why. We're really not. We're reduced to things like sitting next to somebody who was coughing on a bus. That's probably the best you can do, really, in a lot of cases. Not all, admittedly. There are some where we might know a bit more definitely. But even then, even with epidemics that go around populations, not everybody gets it. Why is that? You don't really know. Okay, moving on. And that was just a cave picture, by the way, that I put up there. I think an Aboriginal one, although I'm not completely sure about that. Okay, so this kind of ancient medicine. Time goes on a bit. We come to ancient Rome, which is still a very, very long, ancient Greece, which is still a very, very long time ago. And we get institutionalizing of ancient medicine under the heading, under the figurehead, under the brand name, you might say these days, of Asclepius, god of medicine. Lots of different spellings of his name. If you happen to read about him and it's a different spelling, it's still the same person. And here is supposedly a picture of a stone carving of him. And look what he's got. This is a sign of medicine still today. The staff with the snake round it. Lots and lots of badges of learned colleges and places like that have that as their sign. It's a sign of medicine. And it comes from Asclepius. There he is. He had 2 daughters, said the myth. Because he's a god, he's myth, obviously a myth, but nevertheless, in the myth he had 2 daughters, and you may recognize their names. Hygeia and Panacea. Hygeia and Panacea have been used as figureheads ever since then for the 2 different approaches to healthcare that we'll be talking about for the next few weeks. Hygeia hygiene, that's where we get the word from, cleanliness, good environment, keep yourself healthy, stopping ill health in the first place, preventative, in other words. Panacea. Panacea says, well, yeah, okay, that's all right. If you can do that, fine. But if not, how much better is a pill? Just take a pill. That's a bit of a quick summing up of panacea. And of course, obviously, a combination of the two would be a very good idea. Good living, but if all else fails, well, there's medicine. Sadly, for the next 2,000 years, it's going to be argued about, which seems completely unnecessary, really, as we'll see. And this particular institutionalizing took place in temples because it was still a supernatural approach. The gods had to help. So it became known as Greek temple medicine. Some of the temples were very big and impressive, like the one you can see here in the picture. Some of them are basically just little wayside shrines where people would stop and leave an offering to the gods. Here's rather a posh temple, which, when you read about what went on there, sounds a bit like a combination of a day spa plus psychotherapy. Actually, doesn't sound bad, really, and not very different from some of the stuff we do today, really. Here's the interior of the temple. You can see the big ones had very large grounds. Within there, you could swim. You could bathe in warm water, which is very relaxing, of course. They had libraries where you could go and read. You could walk in the colonnades in the heat of the day, very cooling and relaxing. And slightly more supernatural element to it, of course, there were the priests. What did the priests do? Well, you could go into the actual main bit of the temple, and there, in theory anyway, you would have a relaxing sleep. Cynical people have said, well, there were drugs involved in this. Obviously, they drugged them, so they would have a nice deep sleep. They may have done, who knows. But I don't think anyone would have thought that was bad. They would have thought this was part of the therapy. People dream, they have healing dreams. And when they wake up, they tell the sympathetic priest or whoever it is what they've dreamt in their healing dream. It all sounds quite relaxing, quite frankly, and depending on what was the matter with you, you might well have felt better. But bear in mind, they were a bit of a self-selected group, these patients, because you had to walk to the temple in the first place, so you probably weren't too sick. But again, it was self-fulfilling. If you went there, if you had all this done to you, you were in a psychological state to be made to feel better. And if you didn't, you just rationalized it. You said, well, I came too late, didn't I? Or maybe I've got something so strange that nobody actually knows what it is. Or, I mean, we do the same, don't we? You take an antibiotic, you don't feel better. You don't throw away the whole of antibiotics as being useless, or, well, maybe you do, but you don't have to. You just say something like, well, perhaps I took them too late. Oh, I didn't finish the course. That's how you manage to rationalize how you don't feel so well. Okay, very popular style of healthcare all around the ancient world. This was extremely popular. The temples, as it were, did a roaring trade. But here's where we come to the person I mentioned first. Hippocrates. A rival type of medicine is about to come onto the scene. This is very common again. Instead of people coming together to sort of join and produce some kind of generally useful health care, they tend to be kind of fighting amongst themselves. Sadly, not all that different today. So who's the rival here? Well, the rival is a man who was called Hippocrates. When did he live? We actually have a date. Roundabout, C just means roundabout, circa, 460 to 337. Remember, it goes backwards before the Common Era. So round about that time. We're not completely clear that he actually was a real person. He may have been a combination of a few people, and this name is just like a trademark, as it were. But there's certainly statues of him that claim to be him. Why is he still so famous? Why are we still, in 2016, talking about this bloke who may or may not have existed? Well, here's why, partly anyway. He, to a large extent, systematized the style of medicine and healthcare that he and his followers were promoting. He made it very accessible, and I'll explain what I mean in a minute, not just to people of the time, but to people of the future. And of course, the way to do that, as we'll see in a minute, is to write things down, keep a record of them. But even if you systematize, even if you write everything down, as we'll see later, many people who did that, other people still didn't believe what they said and didn't take it up. In fact, as we'll see in a few weeks' time, one of the people who promoted the germ theory in the early 19th century was actually laughed at. And poor man actually ended up in a lunatic asylum, which was a bit unfortunate. So just because something appears to us to be a good idea doesn't mean it gets taken up. But Hippocratic medicine did. What did it say? It had ethics. It had an oath. And in some, as far as I know, in some places, the oath is still taken today by medical students. It certainly was until fairly recently. And the oath is simply medical ethics, by another word. Why did they need that? Seems like a bit of a strange idea. In fact, one of the parts of the oath is the famous one. Firstly, you do no harm to your patient. First, do no harm. I heard it on television last night. There was a program about euthanasia, and a woman who was a doctor who was obviously very much against it. And she was saying, look, it goes right against our first tenet, which is first do no harm. Now, does she know she's quoting Hippocrates? Maybe she does. But why would you need to say that? I mean, wouldn't it be self-evident that you wouldn't harm your patient? Well, not necessarily. Because there were a lot of medical groups in this period, sects. There was the temple medicine, not that they harm people. But the Hippocratics were saying, none of our treatments will harm people. They might well be sick in the first place. We might not cure them, but we won't make them any worse. That was a really new one. You'll see there's a lot of new stuff here, and a lot of stuff we still have today. This is maybe one we don't have quite so much. I'll show you a picture of this in a minute. The theory of Hippocratic medicine, which was the 4 humors. We'll talk about that more in detail in a minute or two. It was the 4 fluids of the body. Don't worry writing that down for the minute. It's blood, phlegm, black bile, and yellow bile. And this, having them in balance, was in theory the way you're healthy. Sounds a bit strange. I'll show you a picture of that in a moment. And practice. So they had a lot of parts to this kind of medicine. They did stuff as well. They were practical. Practice. They gave advice. They suggested therapeutics, but ones that wouldn't do you any harm. And in the very last resort, they would suggest surgery. And we'll see why that would be the very last resort in a minute or two. So here, basically, you've got what we would expect in modern medicine today, really not so very different. Let's see similarities and differences just quickly. Okay, I said they were written down, which they were. Here's a rather fanciful picture of probably not Hippocrates sitting under a tree, busily writing out his Hippocratic writings. But you can still, this was a Latin version of the Hippocratic writings. Hippocratic writings are still available today in a paperback. You can get very good introductions by people. Not that they'd necessarily be used as medical textbooks, admittedly, but nevertheless very interesting to read. But written by numerous different authors, and so slightly confusingly contradictory at times. But still, you'd see a lot you'd recognize. Okay, so very quickly then, let's just look at what this was. What did the oath say? The oath said they respected their teachers. Ah, that's an important one. Obviously, they thought their teachers were teaching them something worthwhile. But there was none of this sort of undermining. There was a respectful sort of atmosphere, and that's the sort of atmosphere you should have for medical medicine and healthcare. Not perhaps so good, and we still get this today, of course. Hippocratic medicine tended to be a bit of a closed shop. In other words, you could only be a Hippocratic healer if you'd done the training. Now, there's a good and a bad about that, isn't there? Good is that, well, if you go to a Hippocratic healer, you know what they're doing. The bad is that it can perhaps keep other people out. It certainly kept women out. As far as I know, there were very few women associated with this, so it was all men. And the men didn't even do all of it. They didn't do most of the surgery, as we'll see in a moment or two and see why. But it's the same as you have today. We want qualifications for doctors and surgeons, plainly. We want to know they're properly qualified. But of course, I'm sure you know all the arguments about the specializations and how difficult it is to get into them and all the rest of it. It's a difficult problem to know how to get a balance in this, really. Okay, help but not harm for patients. I've already talked about that. We will do them no harm. No euthanasia or abortions. That's quite revolutionary in this period. Certainly they weren't going to kill people, maybe the odd time accidentally, but not deliberately. And they certainly weren't happy about abortions either. Abortions, similarly to the surgery, and we'll see why in a minute. No surgery. Okay, not no surgery, but as little as possible. Now, you might think, well, that's a bit like us today. We want to avoid surgery if we possibly can. Not entirely. Bear in mind that there was no anesthetics, except maybe a good slug of wine. That would be about it, really. There's very little in the way of controlling infection if it sets in, although hospitals are bad for infection, so with no hospitals, probably wasn't as bad as it would be today. But nevertheless, surgery was dicey. Cutting into a body, always risky. Likewise with the abortions. So as far as we know, Hippocratic healers very seldom did surgery themselves. If they did it at all, they would hand it over to the slaves. Because if the patient died, well, it was a slave that was to blame, and that was bad luck, wasn't it? Well, that might sound completely mean. On the other hand, if you were a good surgeon who was also a slave, that was actually some way of getting your freedom, and then maybe even becoming a Hippocratic practitioner. So in fact, it was a way up for slaves. It wasn't altogether a demeaning sort of thing to do. We'll talk more about surgery later on in a different lecture. No sexual contact with patients. For heaven's sake, they had to say that? Well, apparently they did. Apparently some of the sects, and we still get them today, claim to be able to cure people in some quite strange ways. So they did feel they had to say that. Definitely not. And finally, again, something we would totally take for granted, but certainly wasn't taken for granted then, confidentiality of consultation. You didn't go out into the marketplace and gossip about what your latest patient had had. They didn't go out and say, oh, guess what so-and-so's got? Oh. No, you don't say that. What you say to your healer is between you and them. Now, it didn't always work perfectly. As we'll see next week, there was quite a famous practitioner of this kind of medicine who was the most massive gossip, although he didn't actually mention people's names. Didn't always happen, but that was the ideal. So, pretty good. Very quickly. Don't worry about drawing this or anything. It's up on the PowerPoint on Moodle, so you can see it there. This is the theory of the humours. There were 4 humours in the body. They were yellow bile, black bile, blood, and phlegm. They had to be in balance with the elements. In other words, wind and water and sun and stuff like that, and also the seasons. And they also quite conveniently reflected temperaments. So just to give you one very quick example, for phlegm, too much phlegm. What on earth does that mean? Well, in our terms, it would be having a cold. In other words, if you've got a bit of a cold, phlegm comes down your nose, it comes up your throat. We think, good, get rid of it. No, we think that these days. They didn't used to think that a few years ago. You used to get cough suppressants and things like that. Now we think it's better out. Exactly what the Hippocratics thought. Look, they said, you've got an imbalance of phlegm in your body, haven't you? It's all coming out. Excellent. Let's encourage that. And the body will rebalance. The only area there we wouldn't agree with, perhaps, was some of their ideas on blood. We don't generally think that a lot of blood coming out is a terribly good idea, despite the fact that they did. They would think of a hemorrhage as something you had to have, as it were. Odd. The other thing they would do, and we'll talk about this later lecture as well, they would actually do bloodletting. If they thought you had too much blood, in other words, you had a very red face, I mean, we would say high blood pressure these days, obviously. Red face, overexcited, maybe a bit stout, get rid of some blood, you'll feel so much better. And they actually did. They would cut into, not an artery, a vein, and let some of the blood out, and people claimed they felt better. Who knows? That's also, of course, how it reflected temperaments. People with too much blood, angry, excitable, blah, blah, blah. Okay. So there's the humours, and there's the various temperaments. Here's a cross man, too much blood. Here's a lazy man, he's too phlegmatic and blah. Not quite sure what these other two are, but it was a very convenient sort of psychological kind of, and it lasted until the 19th century. People still believed in this stuff. The 19th century. Settlers in Australia who went out to the outback to settle took with them a medical bag. And in the medical bag, they would have a lancet, because they sincerely believed they needed to do bloodletting. And if they couldn't find anyone else to do it, they would do it themselves. So it was still, right until then, I mean, how many theories do we have that last that long these days? Probably not many. All right, finishing off quickly. Practice. We can go through this fairly quickly. Advice for a healthy lifestyle, exactly like now. Justification, maybe not quite so similar. Nature tends towards perfection, and health is perfection in the human body. Notice, a bit of philosophy there. Medicine and philosophy were very, very closely tied in this period, and indeed were until about the 17th century. Science, and we'll see this in a later lecture, was known as natural philosophy. So they had a philosophical take on this as well. The body's always trying to be perfect. So the theory is, if you just leave it alone, it'll get better. On the other hand, if it needs a little bit of help, that's what we're here for. And if all else fails, simples, yes, a few drugs, that's what simples are, but they would just have 1 or 2 ingredients. That's the first do no harm thing, remember? Don't put too much in it, it'll make people feel bad. Probably didn't do all that much good, but you know how much these days actually does all that much good, so probably no worse. Surgery, as we've seen, yes, a bit, and here's the big one. Here's the big one that really set them apart from others in this period. No supernatural intervention. Of course gods were up there, of course we believe in gods, but they don't interfere every day. They're not sending spells on you to make you feel bad. You don't have to pray to them or leave offerings. You believe in them, of course you do, but we'll fix the health. We can do it ourselves. This was a really quite sensible attitude that didn't come back in Europe, for example, until about the 18th or 19th century. In the time in between, it was all very supernatural, as we'll see in later lectures. Okay, just to finish off with, let's just see how this worked. These Hippocratic healers, did they have a headquarters? No, they didn't. You saw Hippocrates sitting under the tree in the other previous PowerPoint. They were peripatetic healers. What does that mean? They walked around. Mainly Greece, but also many of the countries around the Mediterranean. They went in boats, too, because that was, of course, a good way to get to places in the Mediterranean. And it was a very environmental approach, as we've said. So how do those two go together? As they walked with their staff and their trusty sandals, they would be looking around them, and they would be looking at the environment. There's writings about this you can read. They would think, oh, this is a dry area. Look, it's got sandy soil. It's very sparse grass, look at the kind of animals they have, look at the kind of people who live here, what do they look like. Then they would arrive at the nearest village if it was, or town if it was in Greece. They would go to the agora, the central marketplace, because they didn't have a room, a practice room, or they didn't join a group practice. They didn't even usually set up a stall. They would just take off their cloak, if they had one, and put it on the ground, and that's your little bit. And then they had to attract listeners. So they had to be orators. They had to be able to speak. They had to get people's attention with what they were saying. So it was no good being backward. You had to be a bit larger than life. And what would they do? Here's two words we're very familiar with that come from this period. Diagnosis and prognosis. Probably more familiar with the first one than the second one. We like a diagnosis, don't we? We're not very happy if we just have vague aches and pains. We like it to have a name, as they say these days. We're not necessarily quite so pushy about the prognosis, but the prognosis was incredibly important for this period. They wanted to know what was going to happen. That's what prognosis means. We tend not to go in for that too much these days because a lot of the time we simply don't know. The Hippocratics were prepared to have a go at it. Why? Because they could put it in a particular way that would actually be quite encouraging, despite the fact they really had the clue. So they would say something like, oh, I can see your case is quite serious. Not too serious, but quite serious. People like to be taken seriously. Now, here's what you have to do to make yourself feel better. And they would give them a little list to perhaps get more exercise, cut out red meat, not terribly dissimilar to what we'd say today. I can see that kind of thing is exactly what you need. Now, you'd think, well, all right, but what happened if they didn't get better? They covered that one. They would say at the end, that's what will fix you, if you stick to it properly. But if you don't start it right away, and if you don't stick to it quite rigidly, well, I can't guarantee you'll get better. Well, of course, the practitioner would then take themselves off, and they wouldn't be there anyway. But the person would think to themselves, that'll do it. But, you know, we all backslide, don't we? I'll go for a walk every morning. Oh, well, maybe not every morning. Maybe the weather's not very good, blah, blah, blah. So if the person doesn't feel better, they rationalize it. They think it was still good advice. Unfortunately, I just didn't follow it properly. But there was such convincing rhetoric by these peripatetic Hippocratic healers that they were incredibly popular and lasted for many, many hundreds of years in Greece and the Mediterranean countries. There's the bigger one at the Agora where they would set up their stall, as it were. So there's a quick, very quick sketch of early medicine that has a lot of similarities but also a lot of differences. Next week, we'll look at how medicine went into universities. We'll look at it being based on anatomy. And this picture isn't quite as bad as you think, but I'll explain next week what it is. All right, see you all next week. Off you go.